Warning! This medicine that millions take every day could be crumbling your bones from inside out and you don't feel a thing. Mary is 68 years old, a strong woman, raised 3 kids, never smoked, walked every day, a woman who did everything right until the day she tripped on the living room rug. A silly fall, the kind you just get up from, dust yourself off, and move on. Except Mary didn't get up. Her femur broke. It snapped like a dry cracker. At the hospital, the orthopedist looked at the x-ray and said, "Mary, your bone is as porous as a sponge. How did you not know that you had osteoporosis?" And she didn't know because no one connected the dots. No one looked at her pill box and said, "Look, this medicine you take every single day could be weakening your bones." And what if I told you that right at this moment, millions are taking medications that crumble their bones from the inside and they have absolutely no idea? In today's video, I'm going to review the 5 medications that science has already proven that can silently destroy your bones. And each one acts in a completely different way. And I guarantee you, number 1 on this list will shock you. Many people think it's completely harmless, but it's not. But before we start, I need to tell you something fundamental. This video is not for you to stop any medication. If your doctor prescribed it, they had a reason. The goal here is awareness, not panic. It's so you can go to your doctor with the right question. Deal? And of course, if this warning already makes sense to you, hit the like button and subscribe to the channel so you don't miss any information that could protect your health and the health of the ones you love. Turn on the notification bell and think about it. Do you have parents that take medicine every day? Your grandparents? Then share this video in your family group chat. It could literally prevent a fracture. And tell me in the comments, have you fallen and broken a bone recently? And where in the US or the world are you watching from? Write down below. Before the list, you need to understand one thing that changes everything. Your bone is not a rock. Your bone is a living organ. It is constantly rebuilding itself. Right now, as you watch this video, there are 2 teams working inside your bones. The first team is the osteoblasts, the builders. They build new bones. They lay down calcium. They lay down minerals. They strengthen the structure. The second team is the osteoclasts, the demolition crew. They remove old bone to make room for the new. When these 2 teams work in balance, your bone is strong. But when something breaks that balance, when the demolition outpaces the construction, that's when the problem starts. It's like a house where the demolition crew works 24 hours a day and the builders are fired. In a few months, the structure starts to give way. On the outside, it looks firm. On the inside, it's hollow. It is crumbling. And these 5 medications, each one sabotages this balance in a different way. Now, I'm going to ask you to do something. Pause the video, go to your bathroom, your nightstand, the kitchen cabinet, and grab your pill box. It can be the pharmacy bag, your toiletry bag, whatever. Bring it here, I'll wait. Got it? Great. From now on, every medicine I mention, you're going to look for in your box. Don't look at the big brand name on the front. Look for the active ingredient, those small letters on the side or back of the box. That is the true name of your medicine. Ready? Let's get to the list. Start with number 5. Number 5, the breast cancer drug. Breast cancer drug that accelerates bone demolition. I'm talking about aromatase inhibitors. Look on your box, anastrozole or letrozole. The brand names might be Arimidex or Femara. If you found it, first take a deep breath. This medicine is on the list, yes, but it's here for a very special reason, and I need you to listen carefully. These medications are used to treat breast cancer in postmenopausal women. They work by blocking the conversion of androgens into estrogens in your body. And why does this matter for your bones? Because estrogen is one of the greatest protectors of the female bone. It's what keeps the demolition crew, the osteoclasts, in check. When you block estrogen with these medications, it's like taking the brakes off a car going downhill. Bone demolition accelerates, and it accelerates faster than natural menopause ever would. But now pay close attention to what I'm going to tell you. Do not stop taking this medicine. This medicine is protecting you from cancer. We monitor the bone, we replenish, we take care of it. But cancer sometimes doesn't give second chances. And now you understand. You understand why your oncologist told you to take that calcium, why they ordered a DEXA scan every year, why they might have prescribed that osteoporosis injection. You didn't quite understand. They already knew. Now you know it too. If you take anastrozole or letrozole, your mission is one. Go to your next appointment and ask your oncologist, doctor, how are my bones? Are we monitoring them properly? But if that surprised you, just wait. Because number 4 is a medication that many people take without even knowing it affects the bones. Number 4, the migraine medicine that closes the calcium door in your bones. I'm talking about anticonvulsants. Look on your box. Phenytoin, carbamazepine, or phenobarbital. Brand names: Dilantin, Tegretol, Luminol. Your neurologist might have prescribed carbamazepine for a migraine, for neuropathic pain, for trigeminal neuralgia, for nerve pain. They are much more common medications than people realize. And what do they do to your bone? Something very sneaky. These medications are enzyme inducers. They speed up your liver's work so much that the liver starts to destroy active vitamin D faster than your body can replace it. And without vitamin D, calcium simply does not enter the bone. You can take all the calcium in the world, milk, cheese, supplements, and it won't help. Because without vitamin D, the bone's door is closed. And when your body realizes that calcium isn't reaching the bone, it goes into emergency mode. It activates the parathyroid glands, and the parathyroid sends a message. Pull calcium from the bone and dump it into the blood. Your own body starts stealing calcium from your bones to keep your blood functioning. It's as if your liver is devouring the vitamin that protects your bones. And never stop an anticonvulsant on your own. Stopping abruptly can cause a severe seizure. And here, I need women to pay close attention. Number 3, the thyroid medicine that doubles the speed of crumbling. I'm talking about thyroid hormones in excessive doses. Look on your box, Levothyroxine. Brand names: Synthroid, Levoxil, Tyrosint. I am almost certain that many of you are holding this box in your hands right now. Levothyroxine is one of the most prescribed medications in the US. Millions of women over 50 take it every day for hypothyroidism. And let me tell you something, the problem is not the medicine. Levothyroxine is an excellent drug. When the dose is right, it protects, it balances, it is necessary. The problem is the dose. When the dose is higher than necessary, what we call iatrogenic hyperthyroidism, the excess thyroid hormone accelerates the bone remodeling cycle. And when I say accelerates, imagine this. Instead of the bone rebuilding at a normal pace, the demolition crew starts working at double speed. And the construction crew can't keep up. Result, the bone is being destroyed faster than it is formed. Every day, silently. Are you holding Synthroid right now? Then answer me. When was the last time you checked your TSH? When was the last time your doctor reevaluated your dose? Because many, and I mean many women, started on a dose 5, 8, 10 years ago, and no one adjusted it. The dose that was right at 55 might be too high at 65, and the excess is speeding up bone demolition without you feeling a thing. Your mission is go to your endocrinologist and ask, "Doctor, is my dose adequate? Do we need to reevaluate?" And now, number 2, this one everyone knows, the steroid that kills the bone builder in just 3 months. I'm talking about glucocorticoids, the famous corticosteroids. Look on your box: prednisone, prednisolone, dexamethasone, brand names, Deltason, Rayos, Decadron. This is the most well-known bone destroyer in medicine. It is no secret. Every doctor knows it. But what many people do not know is the speed at which it acts. Corticosteroids represent the most common cause of drug-induced osteoporosis in the world, and the mechanism is a triple attack. First, they kill the osteoblasts, the builders. They directly inhibit the formation of new bone. The builders are fired. Second, they reduce calcium absorption in the gut. So, even if you eat well, the calcium doesn't get it properly. Third, they increase calcium loss through the kidneys. Your body flushes calcium out in your urine. It's a 3-flank attack. And the scariest part, bone density loss can start in just 3 to 6 months of continuous use. Months. Not years, months. And here comes the part that catches many by surprise. "Oh, Dr. Andre, but I do not take prednisone." Are you sure? Remember that injection the orthopedist gave for your back pain, or in your knee, or your shoulder? Often, that injection is corticosteroid. The golden rule for steroids is lowest dose, shortest time possible, and never stop steroids cold turkey. Weaning must be done by a doctor. Now, all 4 of these medications I've mentioned so far, they all have one thing in common. They are all medications that doctors prescribe with care. The oncologist knows about anastrozole. The neurologist monitors vitamin D. The endocrinologist checks TSH. The rheumatologist watches the bone on steroids. But number 1 in our list, this one is different because for this one, no one warns you. No one monitors it. You buy it at the pharmacy over the counter. You take it every day, and it is doing something terrible to your bone silently right at this exact moment. Number 1, the heartburn medicine that millions take over the counter and crumbles your bones. Our champions, the most dangerous on the list, not because it's the most potent, but because it's the most invisible. Look at your box right now. Look for omeprazole, pantoprazole, esomeprazole, lansoprazole. It could be the purple pill, the blue one, the white one. Brand names like Prilosec, Protonix, Nexium, Prevacid. You know it. You've probably taken it. And maybe you are taking it right now. Omeprazole and its cousins are so-called proton pump inhibitors, PPIs, are among the best-selling medications in the country. Millions take them every day for heartburn, acid reflux, gastritis, indigestion. Most people think it's a completely harmless pill. It's just to protect my stomach, doc. Except it's not. A study published in 2026 revealed that the prolonged use of these medications cause anemia and bone loss. The study, conducted by São Paulo Research Foundation and published in Science Daily on February 26, 2026, showed that prolonged use alters iron and calcium in the blood, exactly what causes anemia and bone loss. And the mechanism is a silent triple theft. Theft number 1, it steals your calcium. Omeprazole was made to reduce stomach acidity. The problem is that your stomach needs acid to dissolve calcium salts from food. Without acid, the calcium passes straight through your gut without being absorbed. It's as if you ate calcium every day and it just washed right out without even entering the bone. It's like taking the cement out of a brick wall. On the outside it looks solid, inside it's hollow. Remember that back pain that appeared out of nowhere? The one you think's from bad posture or from your mattress. It could be a microfracture, a tiny crack in the vertebra that you can't see on a standard X-ray. The bone couldn't take it. It gave way without a sound, without trauma. It just crumbled. Theft number 2, it steals your magnesium. And magnesium is fundamental for bone metabolism. Remember the cramp? The one that wakes you up at 3 a.m.? That's your magnesium screaming. And as a cardiologist, I'll tell you, when magnesium drops, the heart feels it too. Palpitation, that feeling that your heart skipped a beat. Your heart and your bones are sending the exact same SOS signal. And you think it's just anxiety. Theft number 3, it steals your iron. Without enough stomach acid, iron from food isn't properly absorbed either. The result, silent anemia. Remember the fatigue? You climbed that stairs and got out of breath. You didn't used to. You lay down on the couch at 4 p.m. and you passed out. Your hair is falling out more. Your skin is paler. All of these could be anemia. And the anemia could be from omeprazole stealing your iron every single day. 3 thefts at the same time. Now, put it all together. The brittle nails, the midnight cramps, the unexplained fatigue, the back pain, the palpitation, the hair loss. You went to different doctors. The dermatologist looked at your hair. The orthopedist looked at your spine. This cardiologist looked at your heart. Each one looked at a piece, but no one put the pieces together. No one looked at your pillbox and said, it's all the same thing. It's all the same pill. It doesn't break your bone. It crumbles it from the inside out slowly every day without you feeling a thing. And you know what the worst part is? With the other 4 on the list, the doctor knew and protected you with omeprazole. No one ordered a DEXA scan. No one told you to take calcium. No one monitored it. You took it for years and no one connected the dots. And here is a fact I need you to remember. 50% of seniors who suffer a femur fracture never walk normally again. And up to 20% die within the first year after the fracture. Mary didn't die of stomach issues. She almost died from a bone that crumbled. Now, pay attention. If your doctor prescribed omeprazole for a serious reason, like an active ulcer or severe esophagitis, do not stop. The problem is self-medication. It's taking it for years without reevaluation. If that's your case, then yes, you need to have a chat with your doctor. Now, look at your pill box. Count with me. How many of these 5 did you find? 0. Great. But don't leave just yet. 1. Pay attention. Book an appointment. 2 or more, the risk multiplies. If you take Levothyroxine and Omeprazole, both are attacking your bones at the same time through different mechanisms, and the damage multiplies. What changes now is that you have information, and information in the hands of the patients is a powerful tool in medicine. So here is your 4-step bone protection protocol. Step 1, the audit. Identify if you take any of these 5. If so, write down which one. Step 2, the question. At your next appointment, ask your doctor, Doc, could this medication be affecting my bones? Step 3, the test. Ask for a bone density DEXA scan and blood test, calcium, magnesium, vitamin D, iron, TSH, and ferritin. Step 4, the replenishment. If the tests show a deficiency, talk about proper supplementation. This reminds me of a book I read over a decade ago that left a deep mark on me. It's called Spark, about a science of exercise. The author, who is also a doctor, tells the story of his own mother. An extremely active woman, walked to the grocery store, avoided driving, exercised. She was thin, smart, full of life until in her 80s she fell, fractured a femur. She had surgery and physically recovered well, but her son noticed something. Her memory wasn't the same anymore. That spark started to fade. A few years later, she fell again, fractured the other femur. And after this second surgery, she came back with full-blown dementia. Her brain simply shut down. At the end of the book, the author shares a painful realization. If she had insisted she lift weights to truly strengthen her bones, maybe she wouldn't have met that ending. Osteoporosis doesn't just take away your mobility, it can take away your essence. If you or someone in your family has been taking Omeprazole or other drugs for over a year, share this video right now in your family group chat. It could be the difference between walking at 70 or never walking again. Don't wait to become Mary. Your bones need raw materials now. Did you like the video? Show it, like, and share. My name is Dr. Dre Wambier. I'm a cardiologist, and this is Dr. Dre Health Tips. Remember to subscribe, and I'll see you in the next video. Thank you so much.